I'm Julie Pace at the White House. Just across the street from here, President Barack Obama is holding a bipartisan healthcare summit. Here to break down what's happened so far today is Linda Douglas, Director of Communications for the White House Office on Healthcare Reform. So the president started out this meeting saying that he didn't want this to be about talking points. He didn't want this to be political theater. Is he getting the type of discussion that he was hoping for?
Oh, I think he absolutely is. I mean, one of the things we've seen is that there really are many more areas of agreement than people might have expected. I mean, between the Democrats and between the Republicans, there was agreement on whether they should crack down on waste and fraud, and you heard them say that they would like to accept another one of Republican Senator Coburn's ideas. You heard them talk about how they all agree that there should be big pools for small businesses to reduce the cost of health care for small business. You heard them talk about how there has to be more prevention and wellness programs. That's already in the legislation the president supports. Talked about selling across state lines, selling insurance across state lines. So there was a lot of agreement. There was one area of disagreement, though it seemed that was maybe a philosophical difference. You know, the president said he believes that there should be minimum benefits that consumers can count on when they buy health insurance, so you know you're actually covered. So that if you go to the hospital, you and your doctor decide how long you stay, not the insurance company. The Republicans did not seem to support that notion as much. That was an area of disagreement, but there was a lot of common ground.
At the same time, some of the GOP lawmakers said that they can't just vote for a bill because it has a few of their ideas in it. Do you think that there will be enough compromise to get GOP lawmakers to eventually vote for a bill?
Well, let's see what happens today. I mean, there is no question that the Republicans are well aware that, you know, premiums have doubled over the last 10 years, gone up three times faster than wages, and out-of-pocket expenses, that's the money you pay out of your own pocket, even if you have insurance, has gone up by a third. And, you know, the insurance companies are hiking up rates all over the country. You heard about the 40% increase that was requested in California, 10 times higher than the rate of health care spending. So there's an urgent need, and Republicans are aware of that too. So let's see if we can find some common ground.
What should we be looking for at the end of the summit? What should the takeaway be?
Well, I think the takeaway will be that the country will be much more informed about what is in the proposals that the president has made, how there is the biggest middle-class health care tax cut in history, you know, how it is that this is finally going to put control of health care into the hands of consumers and businesses, and hopefully they'll learn about that at the end of the day.
Linda Douglas, Director of Communications for the White House Office on Healthcare Reform. And a reminder, AP is streaming the rest of the summit live online, so stay with us throughout the day. I'm Julie Pace at the White House.